muscles, as well as the scapulothoracic bony processes. So in no particular order, I'm going to be looking at these three, and we'll jump back and forth between muscles and bony processes. Again, this is a review for therapist assistant midterm. So let's look at 5 scapulothoracic muscles from the back. Starting here up on top, this is levator scapulae, originating on the spinous processes, transverse processes rather, of C1 through C4. And you see it inserting here onto the superior angle. We're going to look at rhomboids minor and major, and we've just classified these because they function the same as one muscle, so rhomboids, an excellent muscle for scapular retraction. Go up here, we see trapezius in 3 parts, upper, middle, and lower fibers of trapezius. Upper works with levator scapulae synergistically. Middle works with rhomboids synergistically, retracting the scapulae. And lower, of course, will depress the scapulae. Over here, we'll get to this one later, but this is latissimus dorsi, not a scapulothoracic muscle, but glenohumeral. Let's just turn this model around. And we'll take a look now at a couple of muscles on the front and the side. We can see over here, this is pectoralis minor. It's a depressor of the scapulae as well as a protractor. And then sitting over here on the side also is serratus anterior. So those are the muscles of scapulothoracic. In other words, when they contract, they will move the scapulae. Pectoralis major is a glenohumeral muscle, which we'll look at on the next station. And of course, we have deltoids as well. Just going to pull this model back for a second and bring this one to the forefront. We've seen this one many times before, and it's obviously an open torso, and we see it from the side. You get a fairly good look at the layering of serratus anterior, deepest, pectoralis minor, and then pectoralis major. This is definitely a model that's going to be used on the exam. And again, it's just sort of a unique layout, a unique view of the layering of those 3 muscles there. Let's go over top and look at some of the bony processes that we can see on the model as they relate to scapulothoracic and some glenohumeral. First of all, the occipital protuberance. This is going to be the origin for upper fibers of trapezius, as the ligaments of the cervical spine will be as well. The attachment for this muscle will be out onto the spine of the scapula, particularly the lateral third, the acromion, as well as the lateral third of the clavicle. When this muscle, upper trapezius, then contracts, it will elevate the scapulae. We see the medial border of the scapulae, which is the insertion for rhomboids, and middle trapezius will come up here as well. The inferior angle of the scapulae will be an attachment point, catching a little bit of the lower fibers of trapezius, but also latissimus dorsi. The acromion, as mentioned, another key landmark on the skeleton for scapulothoracic is this large process here called the coracoid process. This is the attachment for pectoralis minor and the short head of biceps, as well as the origin for coracobrachialis. This is the greater tubercle and lesser tubercle, which we'll talk more about when we get to the glenohumeral joints. Clavicles, of course. And that's mainly the main bony landmarks as we're going to be talking about for scapulothoracic. We'll talk more about glenohumeral when we move over this way. The glenohumeral muscles, we're looking at a few more muscles than we did with scapulothoracic. Supraspinatus, above the spine of the scapula. Infraspinatus, below the spine of the scapula. Tucked in right underneath that, which works synergistically, is teres minor. And then the larger muscle beneath that, not part of rotator cuff, is teres major. Over here we see the ligaments for the acromioclavicular joint. As we turn this guy around, we'll see subscapularis on the anterior surface of the scapula, originating in the subscapular fossa. We're looking here at the brachial plexus, and this is made up of the nerve roots of C5, 6, 7, 8, and all the way down to T1. Leave this model now. We'll come over to this smaller model where we'll take a look at some more glenohumeral muscles. As we saw in the larger torso, we're seeing pectoralis major, deltoid with its parts of anterior, middle, and posterior deltoid. Anterior acting as a flexor, middle acting as an abductor, and posterior acting as an extensor. Once again, we can see upper, middle, and lower fibers of trapezius, as well as latissimus dorsi. We won't look at this model for the muscles of the rotator cuff. It's just a little bit inaccurate in terms of its layout. That's pretty good for this model here. We see a little bit of external obliques blending with serratus anterior as well. Let's take a look at this model here, which is really a good model for looking at the glenohumeral joint and the rotator cuff. We're also going to see a couple of scapulothoracic muscles. Up here is upper trapezius, inserting again into the spine of the scapula, the acromion, and all the way around to the front to the bit of the clavicle. Deltoid sits over here laterally, attaching or originating again on the spine of the scapula, acromion, around to the front of the clavicle, then coming down to insert into the deltoid tuberosity. Looking at the back as we did in the other model, we'll see supraspinatus, infraspinatus, blending beneath it as a synergist for external rotation is teres minor, teres major, and latissimus dorsi. The word teres means round, and it does have a slightly rounded effect. Looking here, this is triceps. This is the long head of triceps, lateral head of triceps, and then we're going to turn this model around. Seeing on the anterior ventral surface is subscapularis. Once again, this is teres major, and this actually is latissimus dorsi with its tendon wrapping around teres major to insert into the floor of the bicipital groove. Over here we can see a bit of a bump. This is the coracoid process. 3 muscles attaching here, pectoralis minor, coracobrachialis, short head of biceps, and over here running through the bicipital groove is a long head of biceps. Pectoralis major, cut away, would be wrapping around on the front. And that's pretty good for that model. Looking at this model here, we're looking at tendons and ligaments. We can see the long head of biceps running through the bicipital groove, greater tubercle, lesser tubercle, glenohumeral ligaments. Up on top, we see the acromioclavicular ligaments, and the acromioclavicular joint will, of course, be surrounded by those ligaments. Once again, the acromion process, clavicle, superior angle, inferior angle, medial border, lateral border of the scapula. Moving on from that, we'll take a look at this model here for the glenohumeral muscles. First of all, we have deltoid. I'm just going to remove deltoid for now. We can see it does have a very large origin all along the spine of the scapula, and again, the lateral third of the clavicle and acromion. Taking that off, just getting biceps set again. We now can see biceps brachii with its head here, the short head going to the coracoid process, coracobrachialis right beside that short head, the long head of biceps brachii. Deep to biceps brachii, we see brachialis. This one inserts into the coronoid process of the ulna, does not have any action in supination, just pure power flexor brachialis. Moving laterally, we can see the lateral head of triceps, the long head of triceps, and the medial head of triceps. Turning around to just review the muscles of the rotator cuff, subscapularis, supraspinatus, infraspinatus, and teres minor. Teres major not part of the rotator cuff down here. We'll leave that model now and finally just look at some bony landmarks before moving into the elbow and down into the wrist. So bony landmarks again, head of the humerus, greater tubercle. This is the insertion for supraspinatus, infraspinatus, and teres minor. This is the lesser tubercle, the insertion point for subscapularis. Bicipital groove. Medial epicondyle, which is the origin for most of the wrist and finger flexors. Lateral epicondyle, which is the origin for most of the wrist and finger extensors. This rounded part here is the capitulum, the trochlea, the coronoid process, which will close in to the coronoid fossa. This is the radial tuberosity, the insertion for biceps brachii. Olecranon process, olecranon fossa. Moving down, we see following the ulna down, we notice that the ulna gets thinner as it makes its way down. See the ulnar styloid process, but also noticing that the articulation at the radiocarpal joint is really just between the scaphoid and the lunate. Continuing on with the rest of the carpal bones, we see the scaphoid, lunate, triquetrum, pisiform, under the thumb, trapezium, trapezoid, capitate, hamate. Then, of course, these are the metacarpals and phalanges. Let's put that down, and now we'll move over to look at the wrist and the forearm. So the wrist and the forearm, we'll start on the muscles on the front or the ventral surface of the forearm. There are 4 muscles in the superficial layer, 1 muscle in the intermediate layer or second layer, and then we're going to see there actually are 2 muscles in the deep or third layer. Let's start with the superficial layer. Pronator teres, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. Beneath that, into the second layer, flexor digitorum superficialis, and in the deepest layer, flexor digitorum profundus, flexor pollicis longus. Those are the muscles, the 3 layers of muscles, again, on the ventral surface of the forearm. We should note at this point in time which muscles are going to go through the carpal tunnel, and that is the 4 tendons from flexor digitorum superficialis, 4 tendons from flexor digitorum profundus, 1 tendon from flexor pollicis longus, and the median nerve. Now we're going to flip to the extensor side. I'm just going to remove biceps brachii. Moving to the extensor side, the dividing line between the country of flexors and the country of extensors is brachioradialis, up on top when the thumb is up. Moving now to the extensors, extensor carpi radialis longus, the shorter one beside it, extensor carpi radialis brevis. Moving to the muscle in the middle, extensor digitorum, going to all digits, and the little one going to the pinky is extensor digiti minimi. Extensor carpi ulnaris and enconius. One more muscle quite deep, if we take off those extensors, we can see supinator crossing over with pronator teres. Just leaving that off. And that completes the superficial and deep muscles of the forearm, flexors and extensors. Just one more model to look at is to take a look at this model here. In this hand, it's a good look at the carpal tunnel. We've opened the carpal ligament. You can see the median nerve, 4 tendons from flexor digitorum superficialis, and we can tell that because it's split at the middle phalanx of each finger, allowing the other 4 deeper to pass through to flexor digitorum profundus, to the distal phalanx of each digit. Flexor pollicis longus going to the thumb. Radial artery. Okay, good. We'll leave it at that.